Hey guys, Jessica here. So today we're going to talk about prenatal franchising, what it is, what the limitations are of it, so you can understand this vital step that you can take to help prepare yourself for your pumping journey. So franchising is not a one-time deal. The reality is your nipple size changes. From the moment you get pregnant, your nipple size will grow until you get to the end of the pregnancy. On average, I'm seeing it grow by several millimeters. That's actually one of the early signs of pregnancy in my practice is nipple pain and a sudden jump in nipple size by more than 2 millimeters when we can't account for it with swelling or bra fit issues that had gone missed. Because most people come to see me periodically and they don't come to see me, preventatively in most cases. So oftentimes they come to check in when something has gone wrong. But if you were to present with sudden onset nipple pain and your nipple size has suddenly jumped up, that would be one of the first questions I would ask you is, could you be pregnant? Because that's often how we discover siblings are coming along. So what happens with your nipple size? You get pregnant, it gets bigger. It kind of stabilizes about 36 to 38 weeks. In some women, it's closer to 32 to 34 weeks of pregnancy. But for most, we try and size you at 36 to 38 weeks of pregnancy. I find 36 weeks is kind of my optimal sweet spot. I only like to do it before then if the mom has complications and we're concerned that this baby could make a sudden surprise arrival. The nipple size will then go up immediately postpartum, and if you have a hospital birth and lots of fluids are given to you, it will go up by typically by a couple millimeters. We see that we need to add a little bit more than what we would add to a postpartum mom whose swelling has already subsided. So it's going to be the biggest immediately post birth, and then it's going to consistently come down. Nipple size very rarely ever increases after your baby has arrived. If your nipple size is increasing, one of the things we screen for is, did we have a sudden change in milk supply? If you are somebody who had had low milk supply issues and we've corrected it, yes, we can see the nipple size increase, but that is not super common. The vast majority of women are going to get smaller over time, which is why if somebody comes in and says that they were sized more than 2 weeks ago and presents with sizing issues, we always check the sizing. I always check your sizing if you're coming into me anyway, because I try not to rely on other people's work because other people have some really creative ways of franchising that have a lot of flaws to it. I use a method that is, I've proven it to work over thousands of women, and I use it because it eliminates as many of these variables as possible so that we can get to the answer as quickly as possible. So, with prenatal franchising, why do we even care about it? Why don't we just wait until after the baby gets here? The reality is that first 10 to 14 days postpartum is super vital for laying down the foundation of a solid milk supply. I don't want to spend any of that time with a suboptimal flange, a suboptimal latch. I want that time to be as effective as possible, and franchising is one of the ways that we help make pumping effective. But how do we do that if this nipple size is going to fluctuate? Well, it's because we're looking at a range of items. If you were to come in to see me for a prenatal franchising, I would not say something like, well, you are measuring 17, you are a 17 millimeter flange. I would say if you're measuring 17, here's the range I would expect to see in the first 10 to 14 days postpartum. Here's the things that we would be looking at. Here's the risk factors, which are, epidural fluids, hypertension, C-sections, narcotic pain meds. All of those can contribute to some flange sizing challenges. We may need to go a little bit bigger and then size down. And then I give you the timelines that we size down. I professionally check sizing at 10 to 14 days postpartum, again at 6 weeks, again at 12 weeks, 6 months, and then every 3 months after that. Or when your period returns, we do like to check flange sizing at that point because typically there's been a change in supply. But what we do is we give you a range. So if you were measuring, let's say 17, which is a really common measurement, if you were measuring 17 millimeters on both sides at 36 weeks pregnant, we would likely be looking at starting you between a 19 and a 21 for that immediate postpartum period. You're typically going to start with the larger size. We'll view it, check to make sure there's no areola pulling in. If there is areola pulling in, we size down from that point. In my practice, we start at the bigger size and size down because I find that too small can cause a lot of damage really quickly, whereas too big is slightly inefficient, but we've got time to get it down because we're monitoring the situation. We're not talking spending 2 weeks trying to figure this out because a lot of this we're doing virtually. You're going to pump with it just long enough to take a video and submit it within a couple hours. We should have those answers. But we're gonna kind of work through that size range. The benefit of this is that we can reduce a lot of the early nipple pain, we can reduce early nipple damage, we can reduce inefficient pumping in the first few days. And we can start with flanges that are already your shape. So the shape of the flange is actually just as important as the size of the flange. So that is a big bonus of prenatal is that I can tell you whether you need a triangular flange, whether you need a bowl-shaped flange, whether you need a broad shape like a Maimontano or a Medela. And then often what I have my prenatal moms get is something like these sizing insert kits. So this kit happens to have everything from 13 to 21 in it, which means I would check you for the flange shape that you need, get you set up with the 24 millimeters. So we use something like a setup like this that likely comes with your pump or a different shape if needed. And then we would have you get a sizing insert kit. We would view that and then very quickly decide, do inserts work for you? Do you need hard plastic flanges? If you are a repeat mother, so you've already been a pumping parent before and you are coming back in, you may have a preference on materials. So a common one is that I have moms who are like, I really liked Willow inserts last time, or I really liked Legendary Milk inserts last time. Okay, great. We can absolutely use the products that you want. Here's the size range that I would prepare to have on hand. And here's the time frames that I would give you. Now, your medical history plays a large role in that. So when I'm talking about generalized, I would tell you I want to check you at 10 to 14 days and again at 6 weeks. If you have preeclampsia, if you need magnesium after your delivery, those are huge risk factors for excessive swelling, and that swelling can persist. So what I would typically do with that mom is I would check at 3 to 5 days, again at 7 to 10. We would be checking every couple days to make sure we keep that flange size optimized. The big thing here is that it's not a one size fits all. We do have it down to enough of a science and enough of an art that we do have a prenatal franchising calculator that'll give you your range as a good solid starting point, and it'll give you the information that you need to size down. However, I keep that for my moms who are resistant to individualized support. I cannot emphasize enough that individualized support from a skilled pumping specialist goes a long way towards assuring that we avoid a lot of the pumping problems. My moms that I start with the prenatal sizing that follow up with me at those time intervals, they typically avoid a lot of the issues that we see with clogged ducts. It also gives us a good chance to kind of check in and see, is there anything else going on? If you have sore nipples at 7 to 10 days postpartum, if we've been doing the sizing, we can functionally eliminate the pump as one of those causes, or we can identify what needs to be changed very quickly so that you don't go weeks thinking, oh, maybe it's the pump, maybe this isn't quite optimized. We can eliminate a lot of those issues a little bit more rapidly, which means we can quickly hone in on what is causing the issue and help you get help. If you're having low supply issues, we can eliminate the issues related to poor stimulation in the beginning if we've had a pump that was properly fitted. It allows us to more quickly proceed with getting you support from your doctor for lab work to find the underlying endocrine dysfunction that often contributes to low milk supply. We have lots of options, but this helps to get us there a little bit more quickly, and it helps us to avoid a lot of the consequences. So hopefully this helps answer your questions about prenatal franchising. If this is something that you feel like is the right call for you, we do offer this service over at Genuine Lactation. We are always happy to help you. Uh, and if you have any questions, please just let me know. Hopefully this helps answer your questions about prenatal franchising and the benefits and drawbacks. If you have any questions, let me know, and happy pumping.